My name is Jordyn Beck. I'm a PCT at Stormontville Healthcare on the stroke unit. I am going to discuss with you some of the things about stroke. Does any one of you know anyone who's ever been affected by a stroke? A family member, a loved one, or a friend? If you do, you might understand some of the complications that go along with having a stroke. If not, that's okay. At the end of this discussion, you'll have a better understanding of some of the signs, symptoms, and different types of strokes. First off, I would like to say that strokes don't discriminate. They affect anyone and everyone. It doesn't matter what height you are, how old you are, if you're skinny or fat, they affect everyone. What is a stroke? A stroke is a blood clot in your brain. A blood clot in your brain blocks oxygen from the arteries and veins, which causes blood vessel death. Stroke is the fourth highest cause of death in the United States. It is also the leading cause of disability today. How to react to a stroke. The American Stroke Association has come up with an acronym known as FAST, F-A-S-T. Each letter stands for something different. The first letter is F, which stands for face. In someone who is having a stroke, they will have facial drooping. A stroke only affects one side of the body. So someone who is having facial drooping can easily be recognized by asking your patient to simply smile. On the affected side, they will have facial drooping. The next letter is A for arms. On the affected side of a stroke patient, they might experience paralysis, numbness, pins and needles, tingling, weakness, and unable to lift their arm involuntarily. A simple way to recognize this is by asking your patient to lift up both of their arms and hold it there for 10 seconds. And the affected side, that arm will fall. The next letter is S, which stands for speech. In a stroke patient, they might have slurred speech, loss of speech, or just be hard to understand. An easy way to recognize this is by asking your patient to repeat some words and sentences back to you. And then T stands for time. First off, when you think someone is having a stroke or stroke symptoms, you want to call 911 immediately. Get some medical health care professionals there as soon as possible. And then you want to look at the clock and you want to see what time it is. When healthcare professionals know how long this has been going on, it gets them an easier, faster way to take care of that patient, to get them back to 100%. What causes a stroke? Right now today there are no known causes for a stroke, but they have found a lot of risk factors. Some of the risk factors include ethnicity, age, family and medical history, obesity, heart disease, drug or alcohol abuse, high blood pressure, atrial fibrillation, smoking, diabetes, and prior TIA or stroke. If you've had a prior TIA or stroke, you're automatically at a higher risk of having another one. There are 8 different types of strokes that can affect you. It's ischemic, thrombotic, embolic, hypoperfusion, transient ischemic attack, hemorrhage stroke, intracerebral stroke, and subarachnoid stroke. The first one is the most common one. It's known as ischemic stroke. It's just a basic blockage of blood flow to the brain, causing the stroke symptoms. The next one is thrombotic stroke. It's a blood clot in an artery leading to your brain. It can be in your neck or just under the brain. It stops the blood flow. Its common cause is atherosclerosis, which is a fatty buildup in your arteries. The next one is known as embolic stroke. This one is very common in the hospital also. We see this a lot. It's a blood clot in your circulatory system. This one is mostly caused by atrial fibrillation, which is an irregular heartbeat. It can be found in your heart, your chest, or your lungs. The next one is hypoperfusion, which is low blood flow due to ineffective heart pumping. Transient ischemic attack, or TIA, is also very common. It's a temporary blockage of blood flow. It acts just like a stroke, but it is not a stroke. It's less time than a stroke, usually 5 minutes or less. The next one is a hemorrhagic stroke. That's a blood vessel that ruptures and bleeds into your brain. When that bleeding compresses your brain tissue, it causes loss of oxygen and loss of blood flow to that brain area, causing a stroke. The next type is intracerebral hemorrhage. That is a ruptured blood vessel deep inside your brain. The last one is subarachnoid hemorrhage, which is a buildup on the surface of your brain due to a broken blood vessel. Your subarachnoid space is between your skull and your brain. So when you have bleeding in between those, you're going to get pressure on your brain causing a stroke. What to expect after a stroke. There are lots of side effects. Each person is different. Everybody heals differently. Some of the side effects are weakness or paralysis, trouble communicating, problems thinking and remembering, changes in mood or behavior, loss or change of vision, and fatigue. Your body is naturally going to be tired trying to work overtime to get you back to 100%. How to prevent another stroke from happening. Your followed up doctor visits, proper medication, staying physically active, eating a good diet, safety in your home, and having a caregiver to make sure you're doing all of this each and every day. I would like to say again that stroke affects everyone. It can even affect you. That's why this information is so important. I hope that I have informed you well on some of this information. Again, my name is Jordyn Beck. I'm a PCT on the stroke unit at Stormont Vail.